Hello everyone, my name is Lilin, student of Bachelor Health Environmental and Safety of Masha University. So today I will talk about the topic, should the government regulate fast food consumption to combat obesity? So let us view the overview of this presentation. I will present the introduction, thesis statement, main points, evidence, case study, conclusion, final message, and reference. So for the introduction, obesity is a big health problem around the world. So since 1975, the number of obese people has become 3 times more and children are also affected. One reason is fast foods. So it is cheap, tasty, and easy to find, but it is not healthy. So for the thesis statement, I believe the government should control fast food. This can help people eat better, so spend less on healthcare and make the fast food industry more responsible. So the fast food and obesity, we know that fast food has too much sugar, salt, and fat. It can make people addicted and unhealthy. Eating it often can cause obesity, heart problems, and diabetes. But it is cheap and easy to buy, so people will choose it oftenly. So it is also advertised a lot, which makes people want to make it more. Okay, so we can look into it. Fast food is also marketed to children. Toys and cartoon characters are used to attract them. So this creates bad eating habits from a young age. Some people don't have healthy food near them, so fast food become their only choice. So we can see that why government regulation is necessary. People's food choice are affected by price, acts, and accesses. So many poor communities don't have healthy option. So the fast food industry does not control itself well. So that's why the government must take action on it. So we can look into the main points one. The main points one is about the power of clear nutrition labels. One way to help is clear food labels. Labels help people choose better food. So we can see that in the UK and Chile, food labels use colors and warnings. This help reduce unhealthy food choice, and labels with education are even more effective. So we can look into is the main points two, which is about the reducing obesity related healthcare costs. Obesity is very important, expensive to treat. In Malaysia, it's cost 4.26 billion in obesity related costs. So Mexico added a tax on sugary drinks. Sales of sugary drinks dropped by 12% and government actions needed for urgent to reduce healthcare costs. So this bar chart shows Malaysia's total health costs and obesity costs. This line chart shows how sugary drink sales dropped in Mexico after the test. This shows that the policies can work. So we come to the main point three, which is encouraging better industry standards. Fast food companies will not change on their own. So the World Health Organization says rules are better than suggestions. Regulations can reduce harmful ingredients like sugar and trans fat. This also makes the food industry fairer for all. So there was a related case study about the Chile's food labeling law. So in 2016, Chile made a new rules. Unhealthy food needed black warning labels, and ads to children were banned. So sugary drinks sales went down by 24%, and we know that people in Chile became more aware and companies changed the recipe. So there was another related case study about the United Kingdom traffic light labels. So this UK's traffic light labels system helped increase consumer awareness. The UK used red, amber, and green labels on food. They also banned junk food apps during kids shows. This change help people eat better. So many companies change their products to avoid red labels. So there was another related case study about the musical soda tax policy. So in this tax policy, introduced in 2014, sales dropped by 12% in the first year and 17% in the second year. So poor families were most affected in a good way. More people choose water and the money health support health program. So we come to the conclusion to stop the obesity epidemic, government regulation is urgently needed. So policies like labeling, tax, and advertising restrictions can make our food environment healthier and more equal. This is important for fairness and health, and so we need action now. For the final message, government rules protect our health. They don't take away freedom, so everyone deserves a healthy food environment. Fast food companies must take responsibility, and now is the time to act. So these are the reference used for this presentation, including studies from the WHO, JAMA, and the Lancet. In summary, regulating fast food is a necessary step toward better public health. So together we can create a food environment that supports healthier choice and reduce preventable diseases. So that's all for me. Thank you for listening to my presentation. Thank you.